Hello and good morning, everyone, all you digital people. And we have the honor here to be again another Friday with Dr. Munné. It's great to be here. Another beautiful Friday, great weather. We have a special guest right here. You want to introduce her, dog?
Yes, we have Sassy today with us. She's one of our puppies, and she's 2 years old, but she's adorable, and she's a very good girl.
She's an expert. She's right now in communication. She's right here, very good with the camera. We just came out with a from a photo shoot session, and she did amazing. So, okay, guys. So you're waiting for good content. Here we are again with you. We're gonna touch briefly. I know Dr. Munay has a long, long day and a lot of activities, but she's giving us a couple of minutes of her time. So let's do our best and leave our questions below. Remember, we stream on Facebook, on YouTube, on Instagram, and everywhere, TikTok as well. So please stay tuned every Friday after 8 a.m. And let's dig in onto more interesting topics such as this one. So, Doctor, please tell us a little bit on how long does recovery last and what should the patients expect after gum surgery?
Yes, so since we've been talking on the last couple of sessions about gum surgery, mostly like gum grafting. So I'm going to talk specifically today about the recovery of gum grafting. I mean, all the recoveries, there's a lot of similarities, but I want to focus on gum grafting. So we're going to be specific in case that you guys are thinking about having this procedure done and know a little bit what to expect. So I think that there's two recoveries. There's an initial recovery that's just when the gum tissue is actually coming together. So it's going to be some stitches in some procedures depending on the technique. There's some techniques that do not require stitches or minimal stitches. So, but regardless, the tissue is in a new position and there's going to be new tissue. Either there's going to be some donor tissue like collagen that we're adding, or there's going to be the same tissue from the patient. But all those procedures, there's something that's either moving or adding or both. So the initial healing takes like about 2 weeks. I would say the first 2 weeks are, critical because we want to make sure that there's not a lot of movement. Those procedures, they want the gum to stay firm and to stay in its place. So the most important thing is to have, be on a soft diet. We recommend our patients not to exercise during those 2 weeks. Maybe you can walk the dog, like Sassy.
That's a nice excuse for those that don't want to exercise during that time, and that's a great excuse. Okay, Doc, very good.
But not going to the gym because that's gonna steal blood from the surgical side. So there's a lot of new blood vessels that they need to form. So we need to have like a positive pressure of blood constantly to create those new capillaries and little arteries and veins. So we want to make sure that the priority in our body is going to be the surgical side, not our muscles or other, parts of our body that we're going to use if we're exercising, especially strenuous exercise.
So for those who you have a question, so when you exercise, does how does that work? Does it pull a lot of your blood pressure here, and that's why there's a risk?
Yeah, so when you exercise, two things. One, there's obviously, usually there's a lot of movement, right? Because exercising is going to involve, movement, and movement is not good for the gum grafting. Another thing is that when we exercise, we pull blood in our muscles, especially big muscles like our quads, our glutes, hamstrings, like all those, muscles in our legs, but even your abs, your arms, there's a lot of blood that goes into feeding those muscles to create that contraction. And especially when we're exercising, we want that muscle to work hard. So we're contracting it constantly. And in order for the muscle to contract, it uses not only blood, but we also use a lot of calcium. And we know that calcium is also important, especially for bone grafting. If we're going to do regeneration with bone,
Yeah.
that calcium is going to be necessary.
It's needed in that area.
Yes, and we recommend supplements. I think supplements are great because everybody's
Write it
diet,
down, guys.
is variable, and there are some people don't do a lot of diet. Dairy products, or there's a lot of calcium in vegetables too, but it's not like people eat sometimes like big portions of the vegetables that we need, right? So we recommend to be on the safe side, to also do supplements with calcium, vitamin D, vitamin C, all the building blocks of our tissue. And but as I mentioned, the first 2 weeks is critical. Soft diet, not to touch the areas. So we give an antimicrobial mouthwash so patients can just rinse and don't have to brush. And the areas, a lot of times covered with antibiotics. We do that especially if we use like a donor tissue, like some collagen or some other matrix. So, but and then there will be like the second part of the healing that will be from 2 weeks on, when things already look like more normal, on the surface area, but inside there's still a process going on. There's still, depending on the graft, the healing is gonna take longer or shorter. So that's something that needs to be also discussed, because every graft is specific.
Yes. Thank you so much for sharing that with us, Dr. You see, so you don't do a lot of the brushing, remember, because you're taking care of that area as well. You use a lot of mouthwash. So basically,
Yes, antimicrobial.
Antimicrobial.
Yes.
So take that note, guys, and please don't hesitate to leave your comment below, your questions and everything. If you're going through this stage, please consult your doctor, your dentist, and if you don't have one, please call us. You'll have your information below, but we're here to help you. Dr. Munné has more than 25 years in the industry. She's leading the industry. You should look us on Google, and we have 4.8 stars. So it's amazing service, but she does really care for our patients. So please stay tuned. Every Friday, we have interesting hot topics on the dental industry, and we'll see you next week. Thank you, doctor.
Thank you. Bye, everyone.